Welcome to today's video, where we will explore 10 dangerous yet often overlooked symptoms of heart disease. Heart disease is one of the leading causes of death worldwide, affecting millions of people each year. Notably, many symptoms of heart disease can appear subtly and are easily mistaken for other health issues, making diagnosis and treatment challenging. In this video, we will delve into the warning signs that the body may send when experiencing heart problems. From mild chest discomfort, unexplained fatigue, to chronic cough or wheezing, each symptom can indicate serious cardiovascular issues such as heart failure, heart attack, and coronary artery disease. These symptoms not only diminish the quality of life but can also be life-threatening if not detected and treated promptly. By recognizing and understanding the symptoms of heart disease, we can be more proactive in prevention and treatment, thereby improving quality of life and longevity. Don't miss any crucial information in this video, as it could help you or someone you care about avoid the severe consequences of heart disease. 1. Extreme fatigue. Extreme fatigue is a common but often overlooked symptom of cardiovascular diseases, including heart failure and circulation problems. This fatigue is a deep and persistent exhaustion that does not improve even with sufficient rest. The primary cause may be the heart's inability to pump blood effectively, thus failing to supply the body with adequate oxygen and nutrients, leading to fatigue. Additionally, coronary artery disease can reduce blood flow and oxygen to organs, causing tiredness. Fluid accumulation in the body, commonly seen in heart failure, increases pressure on the heart and contributes to fatigue. Psychological factors such as anxiety, stress, or depression often accompany heart disease, exacerbating feelings of exhaustion. Extreme fatigue is often accompanied by other symptoms such as shortness of breath, swelling, dizziness, or irregular heartbeats. If you experience prolonged fatigue without a clear cause or with other symptoms, seek medical advice and evaluation. This is particularly important if you have risk factors for heart disease such as high blood pressure, diabetes, smoking, or a family history of cardiovascular conditions. 2. Cold sweats. Cold sweats can be a symptom of cardiovascular problems, including heart attacks. This condition involves unusual sweating not related to environmental temperature or physical activity, often occurring suddenly and accompanied by a feeling of chills or cold skin. Heart attacks are one of the most common causes, where the body reacts by activating the sympathetic nervous system, leading to sweating as a way to reduce stress and cool the body. Additionally, this symptom can be due to reduced blood flow to the heart, often caused by blocked arteries, resulting in the body not receiving enough oxygen and nutrients. This is typically accompanied by other symptoms such as chest pain, shortness of breath, nausea, and fatigue. A sudden drop in blood pressure can also cause cold sweats, as the body tries to adjust to the imbalance. Furthermore, stress or anxiety reactions, although not directly caused by heart problems, can lead to this condition and exacerbate related symptoms. Cold sweats, especially when appearing suddenly and without explanation, should be considered a warning sign and warrant timely medical evaluation. Don't forget to subscribe to our channel to update the latest health information. 3. Dizziness or fainting. Dizziness or fainting is a common symptom of cardiovascular issues, such as heart attacks and arrhythmias. This sensation of lightheadedness or fainting can result from reduced blood flow to the brain, leading to a lack of necessary oxygen and nutrients. This often occurs when the heart is not pumping blood effectively, causing a drop in blood pressure and blood flow. The causes may include sudden hypotension, especially when changing positions from sitting or lying down to standing. Heart attacks where part of the heart muscle does not receive enough oxygen due to blocked arteries, and arrhythmias, which cause the heart to pump blood ineffectively. Heart failure, where the heart cannot pump enough blood to meet the body's needs, can also lead to dizziness or fainting. Additionally, carotid artery stenosis, where the major arteries supplying blood to the brain are narrowed, can reduce blood flow and cause these symptoms. If dizziness or fainting occurs suddenly without an obvious reason, especially if accompanied by chest pain, shortness of breath, or irregular heartbeats, immediate medical attention is required. This is particularly crucial for individuals with risk factors such as high blood pressure, diabetes, a family history of heart disease, or smoking. 4. Chest pain. Chest pain or discomfort is a common symptom of cardiovascular issues, including heart attacks and coronary artery disease. This symptom is not limited to severe pain but also includes feelings of heaviness, pressure, or mild discomfort in the chest. A heart attack occurs when the blood supply to part of the heart muscle is severely reduced or cut off due to a blockage in the arteries, causing intense pain or pressure in the chest that lasts for more than a few minutes and does not go away with rest. Coronary artery disease, which causes feelings of heaviness, pressure, or tightness in the chest, especially during exertion, stress, or after eating, is another common cause. Pericarditis, an inflammation or swelling of the sac surrounding the heart, can cause sharp chest pain, while aortic dissection. It is a serious condition where the inner layer of the aorta tears, leading to sudden and severe chest pain. Heart valve disease can also cause chest pain or discomfort due to changes in heart pressure. Accompanying symptoms may include shortness of breath, cold sweats, nausea, dizziness, and pain radiating to the arms, neck, jaw, or back. 5. Shortness of breath. Shortness of breath is a common symptom associated with various cardiovascular and pulmonary conditions, including heart failure and vascular problems. This symptom is characterized by a sensation of not being able to breathe deeply or get enough air, often becoming more pronounced during physical activity or when lying down. Heart failure, where the heart cannot pump blood effectively, leads to fluid buildup in the lungs, pulmonary edema, and reduces gas exchange capacity, causing shortness of breath, especially when lying down. Coronary artery disease can also cause shortness of breath by narrowing or blocking arteries, reducing oxygen supply to the heart. Heart valve issues, such as stenosis or regurgitation, decrease the efficiency of blood pumping, making the heart work harder and resulting in shortness of breath. Pulmonary hypertension, a condition of increased pressure in the lungs' blood vessels, leads to shortness of breath and can result from various causes, including heart and lung diseases. Pneumonia and chronic obstructive pulmonary disease, COPD, are other common causes, especially in individuals with coexisting heart conditions. Sudden and severe shortness of breath, or shortness of breath at rest or at night, particularly if accompanied by chest pain or irregular heartbeats. 6. Pain in the arm. Pain in the arm, back, neck, jaw, or stomach can indicate cardiovascular issues, including heart attacks. This symptom often extends beyond the chest to other areas of the body, particularly on the left side. When blood flow to the heart is blocked, it can cause referred pain, where nerve pathways transmit pain sensations from the heart to these regions. Angina, caused by reduced blood flow to the heart, can also lead to pain in these areas. Pericarditis, an inflammation or swelling of the sac surrounding the heart, may cause pain radiating to the back or neck. Aortic dissection, a severe condition where the inner layer of the aorta tears, can result in intense pain spreading to the back, abdomen, or arms. Gastrointestinal issues, such as gastroesophageal reflux disease, GERD, or stomach ulcers, can cause chest pain or pain in other areas, often mistaken for a heart attack. If chest pain spreads to the arm, back, neck, jaw, or stomach, especially on the left side, and lasts more than a few minutes, immediate medical attention is necessary. This pain can signal a heart attack or other serious cardiovascular conditions. 7. Edema. Edema is swelling in the legs, ankles, feet, or abdomen, often due to fluid accumulation in body tissues. This condition can be a sign of heart failure, where the heart fails to pump blood effectively, leading to fluid retention in veins, increasing pressure in blood vessels, and causing fluid to leak into surrounding tissues. Edema typically appears in the lower extremities like legs and ankles due to gravity, but can also occur in the abdomen, known as ascites, as the condition progresses. Other causes of edema include peripheral vascular disease, where narrowed or blocked arteries outside the heart and brain reduce blood flow to the limbs. Kidney disease can also lead to edema, as kidneys play a crucial role in fluid removal, and their dysfunction results in fluid buildup. Liver diseases, particularly cirrhosis, can decrease the production of albumin, a protein that helps maintain fluid balance in the body, leading to edema. Certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, blood pressure medications, and corticosteroids, can also cause fluid retention and edema. 8. Irregular heartbeat. Irregular heartbeat, or arrhythmia, is a condition where the heart's rhythm is irregular, which can be too fast, too slow, or erratic. This condition can signal serious cardiovascular issues. Arrhythmias occur when there is an abnormality in the electrical impulses that control the heartbeat. Tachycardia, or a fast heartbeat, occurs when the heart rate is above 100 beats per minute and can be caused by stress, fever, caffeine consumption, or conditions like cardiovascular disease and anemia. Bradycardia, or a slow heartbeat, is when the heart rate is below 60 beats per minute, which can be normal in athletes but may also result from aging or heart disease. Atrial fibrillation is a common type of arrhythmia where the upper chambers of the heart beat irregularly and out of sync, which can lead to a fast heartbeat and an increased risk of stroke. Premature ventricular contractions are another type of arrhythmia where the heart beats earlier than normal, followed by a longer pause before the next beat. 9. Indigestion or nausea. Indigestion or nausea is often linked to digestive issues, but it can also be an early warning sign of a heart attack, especially in women. When a heart attack occurs, the blood flow to the heart muscle is blocked, causing a lack of oxygen and leading to heart muscle damage. In women, heart attack symptoms are often atypical and may include indigestion, nausea, or vomiting, which can easily be mistaken for common digestive problems like gastroesophageal reflux disease, GERD, or stomach ulcers. This can make diagnosis and treatment more challenging, as these symptoms are not always clear and recognizable. Additionally, pericarditis, an inflammation or swelling of the sac surrounding the heart, can also cause nausea and indigestion along with chest pain. This chest pain often worsens when lying down or taking deep breaths and can be confused with digestive symptoms. Heart failure, where the heart cannot pump blood effectively, can reduce blood flow to the stomach and intestines, leading to nausea and a feeling of fullness due to fluid accumulation in the body, including in the abdomen. Angina, which occurs when blood flow to the heart is temporarily reduced, can cause symptoms of nausea, indigestion, or a sensation of fullness, especially during physical activity or stress. 10. Chronic cough. Chronic cough or wheezing are symptoms that can indicate fluid buildup in the lungs, often due to heart failure. When the heart cannot pump blood effectively, blood backs up in the veins, including those in the lungs. This increases pressure in the lung blood vessels, leading to fluid leakage into the tiny air sacs in the lungs, called alveoli, causing pulmonary edema. This fluid accumulation interferes with gas exchange, leading to a prolonged cough and wheezing, especially when lying down or during physical activity. Heart failure can also cause pulmonary hypertension, a condition where the pressure in the blood vessels supplying the lungs increases, impeding blood flow and causing wheezing. Additionally, other lung conditions like chronic bronchitis or chronic obstructive pulmonary disease, COPD, can exacerbate cough and wheezing symptoms, particularly in those who also have heart failure. These conditions reduce airflow, cause inflammation in the airways, and can increase the risk of fluid buildup in the lungs. Thank you for watching our video on 10 dangerous but often overlooked symptoms of heart disease. We hope that the information provided has helped you better understand these critical warning signs your body may be sending. Recognizing these symptoms early and seeking timely medical care can not only save your life or the lives of loved ones but also prevent serious complications in the future. Remember, heart health is the foundation of a healthy and happy life. Listen to your body, do not ignore any unusual signs, and always consult a doctor if you have any concerns about your cardiovascular health. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and stress management, also plays a vital role in protecting your heart. Taking care of your heart health not only prolongs your life but also enhances your daily quality of life. Don't forget that every small action, from regular health checkups to changing daily habits, can make a big difference. If you found this video helpful, please like, share, and subscribe to our channel for more valuable health information. We are here to provide you with the knowledge you need to maintain a healthy and safe life for you and your family. Wishing you all good health and a fulfilling life.